Okay, so we're ready to go back to the PowerPoint. Okay, so we're here. What is positive feedback? So two types of positive feedback are giving birth and blood clotting. So the stimulus, if you get a cut, the stimulus of a cut, and the as your body becomes aware of the cut, it's going to reinforce clotting. If a woman is giving birth, once the birth muscles begin to push out the baby, you want that birthing process to be rapidly completed and stimulated. Okay, so here's if you get a cut, you get bleeding, chemicals release, clotting begins, and so it's a positive feedback to keep the stimulus, to keep the process going. So blood clot stops the blood from bleeding. So if you have a failure of homeostasis, obviously you can die. If you are out in the snow and you don't have any jacket on and you just have regular clothes, obviously you're going to freeze to death. Your system cannot readjust your temperature. If you have diabetes, you have excess sugar, uh, the body cannot maintain the proper sugar level. So we do homeostasis, keep everything at standard values so that we live. Okay? So these physiological systems work to maintain temperature at 37, blood sugar at 100, uh, I think it's decigrams per milliliter. Uh, so the systems are constantly monitoring your temperature, your ionic concentration, your sugar, your blood pressure, all those things are maintained. And that's for you to have an opportunity to study anatomy and physiology. Okay, so we want to know, how do we decide what's where? So what supine means, prone, and so on. Anatomical position, there it is, right there. So you should be familiar with all of these structures, the names of all of these structures. We'll have WebAssign test on these. So your job is to be able to know that this is brachial, in front of the elbow is the antecubitus, and so on. Corpus the wrist, and so on. So this is anatomical position, person facing towards you with the palms turned up. If you look from the rear, make sure you know these terms too. The olecranon is the elbow, it's a bone in the ulna, so that's why it's called the olecranon. Okay, anatomical regions. So there are 4 abdominal pelvic quadrants and 9 abdominal pelvic regions. What do they look like? So you take the stomach and the lower pelvic area, and you can have a right upper quadrant. So notice this is anatomical position. So this is the right side of the anatomical display. So there's 4 quadrants: right upper, right lower, and left upper. What about the regions? Epigastric above the stomach, umbilical above the umbilicus, hypogastric below the stomach. Right hypochondriac, that means below the ribs. So on either side of the epigastric is the left hypochondriac and the right hypochondriac. Right lumbar, because the lumbar spine is right here, left lumbar. On either side of the hypogastric region is the right inguinal and the left inguinal. Inguinal refers to the canal through which the blood vessels and nerves go to the reproductive organs. The inguinal canal is mostly talked about in males. Okay, so we'll be talking about all of these we'll talk about in A&P2, but you should be able to identify the structures of the abdominal pelvic region. So go ahead and study these and so on. Okay, so what are the anatomical directions? Okay, so up is superior, down is inferior, away from the midline is distal, close to the midline is proximal, the side is lateral, the medial is the area of the epigastric, and so on, hypogastric. Caudal is the rear, cranial is the skull region. So you should be familiar and learn these terms. It's just a matter of understanding. So suppose you got cut on your back, that would be a dorsal wound. You could say it's dorsal cranial if it's close to the skull. Okay, we can slice up an organism in various ways. So let's look at those various ways. A transverse plane goes from anterior to posterior. A sagittal plane separates the body into right and left. The frontal plane separates the body into front and back. So we'll talk about these various ways that we can section the body to look at it. Nowadays, you can have a CAT scan and the physician is able to look at sections throughout the body along any of these planes. So remember, superior is up, inferior is down, front, back, right, left. Okay, the ventral body cavity surrounds the lungs, the heart, the digestive, the bladder, and reproductive organ. So the ventral body cavity attaches all of these structures: lungs, heart, stomach, intestines, bladder, and reproductive organ are attached within the body cavity so that they can maintain position and they do not go aimlessly moving around causing problems. The diaphragm separates the chest from the abdominal pelvic cavity. There's two lung cavities, two pericardial cavities. The abdominal pelvic obviously has the abdominal and the pelvic cavities, and this peritoneal membrane which separates or what lines the cavity. Okay, so all these things they're talking about, we just talked about anatomical position, which means that the person is standing with hands at side, palms facing forward, and feet together. Okay, so we talked about the thoracic cavity and the abdominal pelvic cavity. It's separated by the diaphragm. Okay, we can have x-rays, CT scans, MRIs, and ultrasound. I've had a lot of x-rays recently because I had some heart problems, but so a bunch of x-rays, and then I had an echocardiogram and a ultrasound of my right leg to determine blood vessels clotting, blood clots. Okay, so that's an x-ray. So we're going to go ahead and finish. That's enough there. Okay, so we're going to go back to here and we're going to stop recording.